It's 9:20 now, so I know it's very early for all you guys to take some lessons and brush up some old knowledge. So आज सुबह जो 8 बजे मेरे पास पेशेंट थे, he had a very bad gingival condition, gum condition. So he came up with pain, mild pain, and severe burning sensation, and with pain while eating over the gums, and there was no toothache, nothing. Okay, but there were missing tooth some, and they were not calculus but plaque. Okay, so his oral hygiene was not that good. I will be sharing some of the pictures over my video, during my video. So that case, any guy, any doctor in general will think that it is simple gingivitis or maybe pocket formation, but that was not just the case. So it was overall, and there were white patches over the gums which were like, some were removing while rubbing, some were like as it is. Even over the left cheek and the right cheek, there were strangulations and reticulate designs like that. So I found it to be lichen planus. It was overall. When I asked to the patient that, are you suffering from blood sugar, he said that I'm a railway employee, and every year I get annually checked. So yeah, I am sugar positive, but I don't take medicines or medications. Okay. So then I said, "Ki, when did you last check? Before how many years did you get your blood sugar checked?" He said, "Every year." So by his sentence only, by while taking history, I got it that he generally does not keep a check on his blood sugar. Okay. So immediately I have written a blood sugar test to him, because by seeing the gums only, it tells that it is fungal infection plus autoimmune disorder. Fungal infection, why? Because when I rubbed the lesions, some white patches came, but the lesions were overall the like soft tissues. When I rubbed them, few areas it came out, but few areas they were intact. So that gave me a simple diagnosis of OLP, that is oral lichen planus, which is an autoimmune disorder. So he said that before also I had this, I went to an MBBS doctor, and he gave me medicine, I was okay, and then after few months again I am getting this. So I said him that first though you get your blood sugar checked, that is one thing. Second, this is fungal infection. For that also I am writing fungal, antimicrobial, everything I am writing. Then I am writing vitamin B complex with zinc, and then antifungal, then some ointment for before and after meals, and like that. So he said there is no pain, only when I eat, and when I brush it burns a lot and gives me like cutting sort of pain. So then I have asked him that this is an autoimmune disorder. He asked me what is an autoimmune disorder. So when your patient asks what is an autoimmune disorder, make him clear that this is oral lichen planus, it is autoimmune disorder, and this will remain with you for the rest of your life. All you have to, it has got no particular treatment. All you have to do is, whenever this happens, this is not continuous, but this will happen after every interval of time, this will happen on and off. So you have to make very clear that when I am writing a set of drugs, whenever you are feeling such and such type of pain, and this hard feeling, and this itchy feeling, or burning sensation, or whatever may be, then these are the set of medicines you have to continue for 5 days or more maybe. Okay. And you have to keep a check on your blood sugar. So for blood sugar I have written two tests. That one is fasting blood sugar. A random blood sugar or a PP, postprandial blood sugar, is not an apt blood sugar, first of all. Secondly, one has to do the fasting blood sugar, that gives quite proper reading, and the best is HbA1c, that is glycosylated hemoglobin. Glycosylated hemoglobin tells you the exact amount of blood sugar which you had been going with past 3 to 4 months. Okay, so glycosylated hemoglobin, also known as HbA1c test. Okay, so you got to write in that way only. So, and also mention that HbA1c is little costlier than the conventional blood sugar test, because yeah, it is a costlier one. So if any patient who is like underprivileged, while you talk to your patient, you take the history, you have to ask and you have to judge the financial background also. If some labor class patient comes and tells you such and such things, you can't just write HbA1c all of a sudden. To assess the blood sugar in such cases, fasting blood sugar, or fasting your this thing, diabetes checking is enough. Okay, but not postprandial is never apt. Then comes what medicines you have to write. So this is not for this post, this video is not for my general public patients, this is only for doctors, it's a professional post. So if local people, or the ones who are civilians and non doctors, if you're not understanding this video, it is meant for doctors only, it is not meant for you public people, civilians. So it's obvious that you will not understand these things. This is for especially for my doctors, okay, and my fellow seniors, juniors, everybody, colleagues, everybody. So autoimmune disorder may, the set of drugs which goes, or which I have written in his prescription is, first of all, I have written tests. You will write chief complaint on examination, what all you have found, scrapes have come, then some places scrapes have not come, so it is confirmed that it is OLP, that is oral lichen planus. So when oral lichen planus happens, what are the set of medicines you got to write is, number one is your B complex, and if the patient is diabetic, it is very much important to write zinc. So that is why I have written B complex plus zinc. Now you may ask कि मैम you could have written A to Z or A to Z गोल्ड, इसमें तो सब है A से लेकर Z तक, correct. But in B complex, particularly vitamin B1 to B12, everything is there in a very concentrated form and not in ppm, parts per million, or in traces, like the way it is there in a multivitamin, which is like in A to Z or in others. Okay, so that is why I don't generally prefer to write A to Z or others. I want in oral diseases, or in oral lesions, or any soft tissue thing, or in gingival diseases, I'm more comfortable in writing B complex in concentrated form. If possible, if you see that the B complex capsule which we are giving is not enough, then you can even go for B complex injections or methyl cyanocobalamin injections also, never mind folic acid and everything. So we want B complex in a very concentrated form, and that is why we are writing B cosul capsule or plain B complex tablets, which are like available in government sectors and all that. They are raw form of B complex. Okay, and you got to write zinc, because in diabetic patients, they have this healing very slow, whether they have autoimmune disorder or no, but yes, their healing is very slow. So zinc promotes healing because it promotes epithelialization of tissue. Any tissue tear, any damage will be healed by zinc. So yeah, zinc plays a vital role in any diabetic patient. So whenever you are writing any vitamin, make sure that it has to have zinc in the composition. Anyways, then I have written, since he had pain while eating, so I have written Canacort 0.1%. So autoimmune disorder has got only vitamins and corticosteroids as their medicines. They are the drug of choices. You have to write B complexes supplements, and you have to write corticosteroids. They are the only drug of choice. So I must have written tablets, but since he is diabetic, so I have written ointment, that is Canacort 0.1%. That's an ointment, so he has to apply it over the gums for like before meals, that is 4 times a day, which will give him a soothing feeling, and then he can enjoy his food. Very after that, after every food, I have written him Metrohex Plus or Altigel, which contains Metrohex Plus got chlorhexidine gluconate, then metronidazole, and your that enzyme which is there while we do that, or OSMF, oral submucous fibrosis, maybe hyaluronidase enzyme is there, so that also promotes healing. But in Altigel, which is from like Stem Pharma, they have additionally beyond these compositions which I have mentioned, they have benzocaine also. So after applying, they have a very numbing effect, so the pain goes away because they have benzocaine, and benzocaine is nothing but surface like anesthesia, okay, local anesthesia. Then comes so these are the two group of drugs which you have to mandatorily write when there is an autoimmune disorder, that is vitamins and corticosteroids. Okay, other than that, if you see there is a fungal infection super added along with a bacterial infection, like if there is a cut, sore, redness, inflammation and all that, that clearly indicates that it is a super added infection with fungus and microbial attacks. So you have to write an antibiotic, and you have to write an antibiotic, antimicrobial, antibiotic. May I have written megazolid, because that is linezolid, because he is diabetic, and in linezolid is a very broad spectrum antibiotic, so it gives a very good coverage, faster healing. And I have written Canditrol 200, that is antifungal. So twice I have given subah ek sham ko ek for 5 days, 5 continuous days, and that will take care of the fungal as well as the bacterial action also. And I have asked him to get his blood sugar checked, and if the blood sugar is high or beyond its range, then it definitely implies him that he should go and meet his general physician to get his medicines. And he was very much confident that he has no blood sugar, nothing, but by seeing his gum conditions, I could clearly say that he is suffering from good amount of blood sugar, which is like alarming. So, and he didn't know, because जब काम में रहता है आदमी, it may happen कि उसको नहीं पता चलता है कि क्या हो रहा है क्या नहीं हो रहा है, maybe he is tension free, so he is not knowing, but his blood sugar to be checked. कई सारे ऐसे पेशेंट्स होते हैं जिन्हें पता ही नहीं होता है कि उन्हें क्या होता है, और वो एकाएक चले जाते हैं इस दुनिया से. I know many of my cases in my complete career and life I have been seeing. There are people who don't know they have hyperthyroidism and they pass away in a very young age. They don't know that they have blood sugar and they are passing in a very young age, or maybe they are not even 70 and they are passing. So all these things should be checked on time, and it is we the doctors, it's our humble approach should be our humble approach, and it should be our motivation and guidance to the patient that such and such things I am doubting, please you get it checked, and write as a piece of advice at the side of the prescription that these are the things which are advised, which I am doubting. It may or may not be there, but I am doubting, please get it checked once. Get it checked, there is no harm to get it checked. So yeah, and I have also asked him to avoid warm food for probably 2 days. Okay, 2 days it will be like quite healed. Along with that, I have also asked him to brush, because when I have seen his plaque count, I found that he might not be brushing. So when I asked him, are you not brushing for many days or what? So he said no, I'm not brushing, I'm brushing with fingers. I said brushing with fingers is not even brushing. So he said that whenever I'm brushing, it is hurting my gums a lot even more. So I said okay, there is a hack, you have to brush with a very ultra soft brush, but you have to brush. Okay, and you have to brush after dinner and after breakfast positively, so that the plaque count reduces and it will not super add with another bacterial infection like E. faecalis or something. So this was the piece of advice to all my fellow doctors, and I know this, you all might be knowing this, but it was just a regular brush up of what I have seen and I am experiencing, and I'm sharing my knowledge and experience with you. So yeah, it's just a revision. So thank you so much for watching me. This is Dr. Sukirti signing off. Today is 8/8/2024, and namaste.